Look at fibrin sealants in a whole new way with ETHICON's Vistaseal Fibrin Sealant, an advanced solution to surgical bleeding management. Whether dripped or sprayed, Vistaseal provides a rapid, adherent, and durable clot on targeted tissue and has been demonstrated to sustain hemostasis even in high-risk patients. Vistaseal is indicated as an adjunct to hemostasis for mild to moderate bleeding in adults undergoing surgery when control of bleeding by standard surgical techniques such as suture, ligature, and cautery is ineffective or impractical. Vistaseal is effective in heparinized patients. Do not inject directly into the circulatory system. Do not use for the treatment of severe or brisk arterial bleeding. Do not use in patients with history of anaphylaxis or severe systemic reactions to human blood products. Do not use Vistaseal for spraying unless the minimum recommended distance from the applicator tip to the bleeding site can be achieved. The device comes packaged all in one box containing pre-filled syringe and malleable dual applicator that allows for dripping or spraying in open surgery. Once biologics are thawed, the device is ready for sterile field use. No other fibrin sealant preps faster. Just click and spray. Vistaseal features a next-generation applicator, offering easier setup, enhanced spraying control, and more flexible product use. Once thawed, Vistaseal does not require additional warming, versus TISSeal, which must be warmed for 4 minutes before use. Vistaseal can also be used at a broader temperature range. TISSeal must be kept between 33 and 37 degrees. The Vistaseal fibrin clot begins to form the moment the biologics mix within the static mixer, providing a reliable fibrin clot regardless of the patient's coagulation profile. The easy-to-assemble device comes in 3 sizes: 2 milliliter, 4 milliliter, and 10 milliliter. It is designed with a malleable dual-lumen tip for greater access to challenging anatomy while either spraying or dripping. The Vistaseal dual applicator helps save space and valuable OR time by eliminating the need for CO2 canisters, hoses, pressure regulators, and other equipment. Finally, the pre-filled device and adapter can be combined with a 35 cm rigid tip or a 45 cm flexible tip for minimally invasive surgery. With this innovative next-generation device, you can deliver your fibrin sealant with the flexibility and efficiency you need when you need it. Just click and spray. Vistaseal Fibrin Sealant, Human. Important safety information. Indication: Vistaseal is indicated as an adjunct to hemostasis for mild to moderate bleeding in adults undergoing surgery when control of bleeding by standard surgical techniques such as suture, ligature, and cautery is ineffective or impractical. Vistaseal is effective in heparinized patients. Contraindications: do not inject directly into the circulatory system. Do not use for the treatment of severe or brisk arterial bleeding. Do not use in patients with history of anaphylaxis or severe systemic reactions to human blood products. Do not use Vistaseal for spraying unless the minimum recommended distance from the applicator tip to the bleeding site can be achieved. Warnings and precautions. Thromboembolic events may occur if Vistaseal is administered intravascularly. Only spray Vistaseal if it is possible to accurately judge the distance from the spray tip to the tissue surface. Hypersensitivity reactions can occur. May carry a risk of transmitting infectious diseases, e.g. viruses, the variant Creutzfeldt-Jakob disease, VCJD agent, and theoretically, the Creutzfeldt-Jakob disease, CJD agent. Adverse reactions. The most common adverse reactions, reported in greater than 1% of clinical trial subjects, were nausea and procedural pain. For complete indications, contraindications, warnings, precautions, and adverse reactions, Please reference full package insert. Please see accompanying prescribing information. ETHICON Fibrin Sealant, Human. Important safety information. Indication: ETHICON Fibrin Sealant, Human, is indicated as an adjunct to hemostasis for use in patients undergoing surgery when control of bleeding by standard surgical techniques such as suture, ligature, or cautery is ineffective or impractical. Contraindications: do not inject directly into the circulatory system. Intravascular application of ETHICON may result in life-threatening thromboembolic events. Do not use in individuals known to have anaphylactic or severe systemic reaction to human blood products. Do not use for the treatment of severe or brisk arterial bleeding. Do not use ETHICON for spraying in endoscopic or laparoscopic procedures where the minimum recommended distance from the applicator tip to the target site cannot be ensured. Warnings and precautions: life-threatening air or gas embolism has occurred with the use of spray devices employing a pressure regulator to administer ETHICON. This event appears to be related to the use of the spray device at pressures higher than recommended and/or at distances closer than recommended to the surface of the tissue. Monitor changes in blood pressure, pulse, oxygen saturation, and end-tidal CO2 when spraying ETHICON because of the possibility of gas embolism. To reduce the risk of potentially life-threatening gas embolism, spray ETHICON using only pressurized CO2 gas at the pressures and distances recommended for the specific tips. Use ETHICON spray application only if it is possible to accurately judge the spray distance, especially during endoscopic or laparoscopic procedures. Prior to applying ETHICON, dry surface areas of the wound by standard techniques, e.g. intermittent application of compresses, swabs, use of suction devices. Prepare and administer ETHICON according to the instructions and with only devices recommended for this product. May carry a risk of transmitting infectious agents, e.g. viruses, the variant Creutzfeldt-Jakob disease, VCJD, agent, and theoretically the Creutzfeldt-Jakob disease, CJD, agent. The most common adverse reactions reported in clinical trials are peripheral edema, abdominal abscess, infection, hematoma, incision site hemorrhage, vascular graft occlusion, postoperative wound complication, and decreased hemoglobin. For complete indications, contraindications, warnings, precautions, and adverse reactions, please reference full package insert.